No
Ano bang
balance
difference
billing and
nun?
zero balance billing seem to be the same. No, it's not.
Okay, sige, let's differentiate it. Isa-isayin natin. Ang dami mong sinabi, Secretary, pero lahat yun very interested ako to know
Talaga?
more about it because ang daming confusion na
True,
online,
and
di ba?
health system is very complex.
Right.
And even some of my colleague doctors, hindi naintindihan yung how health is financed.
Okay, so
start
zero
with
balance
zero
versus no balance.
Zero balance, ang precursor nito was the no balance billing in 2012. I was undersecretary then. There is the indigents, the really poor people, part of the Pantawid Pamilya program or the Poor Peace, yung binibigyan ayuda. And if they get admitted in a DOH hospital, we develop the no balance billing. So anong problema doon? You have to prove you're indigent. You have to prove you're poor and you have no income. And then the hospital won't bill you na. PhilHealth lang, okay na yan. That's in DOH hospital and many LGU hospitals implemented it. Okay lang.
Basta sponsored member ka.
The problem is if you have work and you have income, sisingilin ka ng hospital.
Exactly.
For medicines, for tests, and everything. That's what BBM changed. In his SONA last July, sabi niya, bayad na bill nyo. Basta na-admit kayo sa basic accommodation or ward accommodation in any DOH hospital.
And we're talking about not just yung ito yung mga tawag dito kahit may kakayahang magbayad. Basta sa ward ka.
In fact, I visited a patient in NKTI. He is unemployed. He's employed BPO. Hindi maliit ang kita niyan. May HMO siya. In one day, naubos in a private hospital. And he had cancer. So he needed an operation. The operation was like a 400,000 peso cost. He went to the outpatient of NKTI. He was in there. Na-admit siya. Of course, the basic accommodation is air-conditioned, pero may kurtina.
May kasama.
May kurtina. May kasama ka dun sa floor na yun, pero may kurtina kasi yung privacy.
But once you avail private room, hindi ka nakasama sa zero balance
so yun
billing.
ang klaro natin. Pag ikaw nag-pay, you're a private patient, you cannot get zero balance billing. You have to be in basic accommodation. So itong taong to, binayaran ng hospital 450,000. Operahan siya. Well, zero. Wala siyang binayaran.
Do you have data, Sec, of how much percentage?
So from July to December, we have 1.3 million patients discharged in all 83 hospitals.
Zero balance billing.
74.6 billion pesos has been spent. In fact, kinumpute ko na yan. Sabi ko, what is our average cost per patient? At that computation, I discovered we're spending about 57,000 pesos per patient. That's the average. But I've seen a patient discharged with 2.7 million as a bill. Zero din binayaran niya. So nagre-range yun. Merong mas maliit, meron covered na lahat. What we've discovered is 30% of what we pay for of the financing comes from the PhilHealth. The reimbursement to the hospital, let's say kung 57, so gawin na natin 60,000. So parang mga 20,000 dyan, PhilHealth nagbayad. And then the remaining other 30%, another 20,000, binayaran ng MAIFIP. And then the rest, yung ang tinatawag naming operating expense and personal services, yung sweldo ng doktor ko, nurse, at saka yung gamit namin sa ospital. So that's how we are financing zero balance in the DOH hospital. So,
we have to clear that, in
payo ko sa
DOH
mga tao,
hospital.
punta kayo sa DOH hospital, including heart center, kidney center, and lung center. So all our hospitals, 90% of the beds are basic accommodation. Only 10% are private or pay. Pag nag-private ka kasi, talagang you now are saying, I'm going to pay. I want a private room, I want to pay a doctor. So never go to a private room and then ask for ayuda as zero balance because you are now excluded. So pupunta ka dapat sa basic accommodation and everything will be free. Sa heart center, ganun din. At kidney center, 70-30 naman doon. Because it's a corporate hospital, they have to earn income to pay for the basic accommodation. So 70% of the beds in heart center are pay beds. And then only 30% are basic accommodation. Yun yung zero balance, 30%. Sa private naman, baliktad. Only 10% are basic accommodation and the 90% is pay. Now, sa pay, hindi pa zero balance kasi because it's funded by the hospital themselves, by private corporations, they'll still charge you, but it's a lower rate.